Hi, I'm Dr. Elna Rudolph, and I would like to welcome you to this talk on what to expect on the first night that you have sex. I'm a medical doctor working exclusively in the field of sexual medicine and the clinical head of My Sexual Health. I thank Femogene, Female Hygiene Products, for sponsoring this educational video. If you are still a virgin and nervous about the first night, here are answers to some of the most important questions you might have. Will penetration be possible? It is not always possible to tell beforehand. It will depend on whether you are completely relaxed and adequately aroused. If you are not able to insert tampons and at least 2 fingers into your vagina, it will probably be very difficult to have intercourse. We help women with these problems with creams and exercises to stretch the vaginal canal before they have sex the first time. If it's impossible to penetrate, don't worry about it. Enjoy the other things there are to sexual intimacy. If it remains impossible or very painful to have sex, make an appointment for us to help you find out what the reasons are and treat it. Will it hurt? If you can insert tampons and 2 fingers, it should not hurt too much. It is extremely important to make sure that you are very aroused by the time you try to attempt penetration. If you are not aroused, you are dry, the uterus sits low in the vagina, and the muscles around the vagina are not relaxed. All of these factors will contribute to pain. If it hurts, don't worry too much about it. It will get better every time you try. Use lubrication, like this one from Femogene, for the first few attempts. Apply it to your vaginal opening and to the head and the shaft of the penis. Don't use flavored lubes initially. It might cause infection. Once you are comfortable with sex, you can try other lubes that tingle or taste nice as long as they do not cause infection. If sex continues to hurt, come and see us. Sex should not hurt. We will find the cause of your pain and treat it. Will it bleed? If you are using big tampons, it might not bleed. This does not mean that you are not a virgin. It might also bleed quite a lot and more than once. That is normal. If it's more or less the same amount that you usually bleed during menstruation, you do not need to worry. If it does not stop after a day or 2 and is more than your menstruation, you will have to go and see a doctor. What will be the best position to use? The so-called missionary position, where the woman is lying on her back, is most likely the best. Put a pillow under your bum to make the angle easier for him to penetrate, and make sure that you are very aroused by the time he tries. Take it slow. You might find that there is some resistance, but with mild pressure, he should be able to get through it. You can use your hand to guide his penis in the right direction and to determine the pace at which he proceeds. Don't expect to be able to do heavy thrusting on the first attempt. Just enjoy being so extremely close. If you are comfortable, you can start with gentle movement. Some women prefer to be on top. They are more in control and can lower themselves onto their partner's penis at a pace that they are comfortable with. You might find that only 1 or 2 positions are comfortable initially. That is okay. As you get used to it, it might become more and more comfortable to try other positions. What is the best time? You might choose not to have sex on the night of the wedding. You're so tired of the biggest day of your life, and often the drinks have been flowing for you and for him. Tiredness and alcohol interfere with sexual performance. You've been waiting for this night for a very long time. It's perfectly okay to wait 1 more night and try it the next day. Men have higher testosterone levels in the morning, and therefore they also have higher libidos in the morning. Make sure you have some refreshing gum next to your bed to do away with those morning breaths. They can be a bit of a passion killer. What is good foreplay? If you've been only kissing up to now, it is unrealistic to think that you will be comfortable with foreplay and penetrative sex right away. You might want to take it slow and just give your bodies the chance to get used to each other before you attempt penetration. It can even take a few days or weeks before you feel ready, and that is perfectly okay. Foreplay usually involves intimate kissing, caressing the entire body, as well as touching, licking, sucking, and kissing the breasts and genitals. There are all kinds of oils and lotions to help you make foreplay more sensual and exciting. The most sensitive areas for women are their breasts and the clitoris. The clitoris sits just under the place where the lips split, just below the bony area. It is extremely sensitive and therefore oral stimulation of the clitoris works particularly well. The G-spot is 1/3 into the vagina on the anterior wall and is best stimulated with a finger. Not all women have one, so don't worry too much if you can't find it on your honeymoon. For the man, the most sensitive area is the head of the penis, but the scrotum, testes and perineum, the area behind the scrotum, as well as the nipples can also be stimulated to give him pleasure. To feel comfortable with foreplay, you will want to make sure that you are fresh down there. It is best to take a nice bath or shower, together if you are comfortable with it, to relax and get yourself in the mood. If a shower is not possible, you might decide to use something like Femigene's wipes to clean the area before you become intimate. Will you have orgasms? It is very likely that your partner will have an orgasm very soon after penetration. That is perfectly normal in the beginning. It is also likely that he will not have an orgasm at all due to the pressure. Don't worry about it and just enjoy the fun and intimacy of the experience. Only 1/3 of women experience so-called vaginal orgasms. That is an orgasm during penetrative sex. Another third will have it during penetration, but only if a clitoris is stimulated. This can be done with her hand, his hand, a small external vibrator, or other forms of indirect stimulation. Another third of women can only orgasm through foreplay, with either manual, oral, or vibratory stimulation of a clitoris. Remember, you can have perfectly satisfying sex without having an orgasm. Do not put too much pressure on yourself in the beginning. It is extremely important that you know your own body to guide your partner to give you the right stimulation. If you've been uncomfortable to explore yourself, it will take some time for you to figure it out, and that is also okay. Do not expect to see any fluid when you have an orgasm. It is also normal to expel up to a cupful of fluid during an orgasm, but that only happens in a small minority of women. Remember, it's your right to have an orgasm during every sexual encounter, but you do not have to feel obliged. What happens after sex? If you did not use a condom, his semen will eventually run out of your vagina. For some women, this happens immediately, and for some it happens over the next few hours or even days. Make sure you have some tissue close to the bed to avoid making a mess. Some women also prefer to put a towel under them in case they make a mess. Some women can just put some tissue or a small pad into their panties and sleep like that, but most prefer to get up, sit on the toilet for a while in order for the semen to run out. It is also a good idea to pass urine after sex. That clears any bacteria that might have moved up your urethra during sex to avoid a bladder infection. Some people prefer to take a shower after sex. Make sure you use the right soaps when you clean your genital area. You can be especially sensitive straight after sex. Do not douche or try to wash the semen out of your vagina. That is a very harmful activity. It washes away all the good bacteria and changes the pH of your vagina. If you do not shower, you might prefer to use some of the wipes, like these ones from Femigene, to clean the external area before you go to bed. It is extremely important to wipe away any flavored lubrication or any other product you might have used during sex, as these can cause significant irritation and even infection. If you feel sensitive or sore after sex, you can put a bit of something like Femigene soothing gel on to ease the irritation. It is normal to experience some burning afterwards, but it should disappear within a few minutes. If it lasts longer than that, you will have to make an appointment. It is not normal to be uncomfortable for hours and days after sex. I hope that this has answered some of your questions. Let us know if you have any more questions. We will attempt to answer them in one of our next videos. Thanks again for listening. I'm Dr. Elna Rudolph from My Sexual Health, and I thank Femigene again for the sponsorship of this video.